Hey guys, welcome back. Today's video is a direct response to a question that I received in a comment for another video. I always ask you guys to leave me your questions, let me know what else you'd like to hear about. And on a previous short video, I had a little bit of information about a condition called hidradenitis suppurativa, and there were a lot of questions for more information about this, and that's what we're going to review today, a little bit more in depth, but we're going to do it by using other TikTok videos that explain it in the direct words of individuals who suffer with this condition. We're going to look at some TikTok videos from other doctors, and then I'm going to give my expert opinion as somebody who treats this in the clinic very regularly. So let's jump into it. So as I mentioned, we're going to be talking about hidradenitis today. HS is an easier way to say it. It stands for hidradenitis suppurativa. So we're going to mostly be calling this HS today, but we're going to hear about it in the words of patients who experience it on a daily basis and from other experts. So this first video, the first couple really, are going to give you kind of a background and introduction into the condition. Then I'm going to talk about what I can add to the conversation about that. So let's check out the first video.
What's on your skin? Part 10. Do you get painful bumps in the armpits and groin? If this happens frequently, you may have something called hidradenitis suppurativa. It's often mistaken for boils or ingrown hairs.
True.
And it occurs due to plugging of the hair follicle. If left untreated, it can lead to severe scarring.
All right, so that's a real quick rundown by Dr. Lee, and you can find his YouTube channel. I'm going to link that in the description of this video. Tons of great information there on all different skincare topics, so I'd encourage you to check that out if you're not already a subscriber to his channel. Hidradenitis is a really debilitating condition for those that have it, and one of the things that makes it particularly challenging, especially emotionally, is the delay in diagnosis, because people are often told they just have boils or they have an abscess, and the doctors that they're seeing, whether it's an urgent care, an emergency doctor, or sometimes even dermatologists and family physicians, they don't put it together that this is part of a chronic systemic inflammatory condition. And it's not just a one-off having a boil here or there, because when you start to get these things frequently, it is part of hidradenitis suppurativa. So it's important to know that individuals have suffered with this often for a long time before the actual diagnosis is made. Something else we see in the video here from Dr. Lee is that there are 3 stages in hidradenitis suppurativa, and that's according to the severity. So stage 1, 2, and 3. When we get to stage 3, this is almost always active lesions, tons of scarring, lots of fistulas and sinuses with pus coming out of them frequently, and it's really, really not a fun condition to have. The emotional toll that it takes on somebody is significant and among the worst of any skin condition that somebody can have. Another thing that video talks about is where this is commonly located, often under the arms. It can also happen on the buttocks, in the groin, and it can happen under the breasts, and these are the most common areas for it to occur. Now, it is more common in women than in men, but men may suffer from this condition as well, and we're going to look a little bit about that in some of our other videos coming up here in just a couple minutes. Now, the next video gives you a little bit more information, but this is coming from somebody who does waxing. Waxing is a procedure, of course, to remove hair from different parts of the body, and this person has waxed individuals that suffer from HS. So let's see what they have to add about the condition and learn a little bit from them as well.
Let's talk hidradenitis suppurativa. I probably pronounced it wrong, so let's call it HS.
It's not easy to pronounce.
HS, you can easily feel isolated or at fault, but neither are true. Let me reassure you that this is not your fault and you didn't cause this. HS is a chronic or long-lasting inflammatory skin condition. While the exact cause of HS is unknown, the immune system is believed to play a role. You may begin to notice small bumps under your skin that seem to be the size of a pea or marble. These bumps usually start to develop in areas where the skin rubs together, where you have hair, and where sweat glands are located. Underarms, groin area, under the breast, buttocks, inner thighs. This can be very painful and uncomfortable for sure. HS isn't contagious. It isn't caused by poor hygiene, and it's not an STD. So can you get waxed if you have HS? The answer is yes. However, you cannot come in if you're going through a flare-up. Your skin has to be kind of healed because we don't want to irritate the skin any further. For treatment, I highly advise you to seek a doctor. Best of luck. Know that I am here for you.
All right, that was a great description. I almost, with the background music, felt like I was watching like a commercial because the description was so good, the music was there. This person has a lot of knowledge about HS. Now, there's some things in there that they mentioned, of course. HS is not contagious and it is not a sexually transmitted infection. These are common misconceptions, and this is one of the reasons that individuals with HS are really impacted by the disease, is because others may have the perception that it is contagious or that it was sexually transmitted as an illness, because it can often occur in the groin. And those things couldn't be further from the truth. This is an autoinflammatory condition. It does have to do with the immune system, but we don't really know what causes it in all individuals. But it is important to know you're not alone. This condition is at least as common as psoriasis, and probably everybody watching the video knows somebody with psoriasis, but hidradenitis is not something that's talked about the way that we talk about psoriasis. Another mention in this video is that you can get waxed while you have hidradenitis as long as it's not active, if you're not actively draining purulent material. This is something that you'll find mixed opinions about on the internet. Most of the time, you'll probably be discouraged from getting waxed or from sugaring if you have hidradenitis. Now, there are people who definitely say that waxing regularly and removing that hair, or depilatory treatments as we call them, will help their HS. We do know that there is good evidence that laser hair removal, actually getting rid of the hair permanently in the areas where you suffer from HS, can reduce the incidence of flares. But it's a little bit mixed as far as waxing goes, and even shaving close to the skin can actually cause exacerbations in people, and that's what studies have shown. But you'll always find exceptions to the rule where some people do get improvement from waxing or sugaring. If you are going to shave, it's important not to really shave with a razor that has multiple blades, because those lift the hair above the skin, cut it, and allow it to drop down below the skin, increasing your risk for ingrown hairs. I really appreciate in that video that she encourages her clients to work with a physician if they have hidradenitis, because this really can be a team approach where you have somebody that does laser hair removal, somebody that does waxing or sugaring, a physician, things that all together can help to reduce the flares, to decrease the severity of them when they happen. So it really does have to be a team approach, and you really need a whole support system to help give encouragement and to feel like you're not alone, because hidradenitis can be a very socially isolating disorder. And we're going to look at a couple videos that talk about some of the things that go through your mind when you have HS, and how individuals with HS approach their day-to-day lives in a different way than anybody else. This next video is from somebody who has HS, and they're going to talk about their experience and their day-to-day life. Let's check it out.
Hey everybody, I want to come on here and talk today about something that a lot of us have, but nobody ever talks about, and I feel like it carries a lot of shame because there is no discussion about it. So I get these scars under my arms. That one is the worst one. And I would just get these really inflamed, what felt like ingrown hairs, but it's a disease. I can never say it. It's HS for short, hidradenitis suppurativa. I think,
not easy
but
to
so
say.
common. It's not something that's more common in plus size people. The more you sweat and the more things rub together on your body, athletes have it a lot. It just happens. It creates this tunneling under your skin, and you get the same flare-ups in the same spots. I have stage 1, so mine is comparatively not as bad as other people, but it's still a source of self-insecurity. So I hope it helps to see it.
I love this. It's important for people to get out and share their story when they're suffering from any condition, really, so that others don't feel isolated. So I really compliment her on her bravery and her courage to get out and talk about her experience with it. She talked about how she had stage 1. This is the most mild form, where you get occasional cysts or boils that occur under the skin, and they can leave dark marks and some mild scarring. And then stage 2 is, of course, going to be more severe, and stage 3, as you saw in the very first video that we reviewed. Now, she does say some things here that are absolutely true. Hidradenitis, or HS, can occur in individuals of any size. There are some studies that show that losing weight may help. There is a little bit of an association with being overweight or obese, but it does happen in individuals of all sizes. So this is not a condition that is your fault if you suffer from it, and you may not be at a body weight or a BMI of less than 25. So please don't go blaming yourself for that in any respect, because I've treated patients of all ages and of all sizes with HS. Another association is smoking, and there have been some studies that have shown that if you stop smoking, the HS can get less severe, but it's not a cure by any means. Athletes certainly can get this, and it does occur in hair-bearing areas like she talked about, and we've already discussed in this video. So she had some really good things to add there, and it's nice to see people sharing their stories to help give encouragement to others. The next video that we're going to look at is a stitch from TikTok on the video that we just saw. So you're going to see a short clip of that video again, and then we're going to hear from another experience of a patient that has HS.
So I get these scars under my arms. That one.
Okay, I don't know how to TikTok, but I learned how to stitch just for this because this girl has something called HS, which I never got a diagnosis for it either. I've literally been to like probably 5 dermatologists about it, but finally the last one I went to, female by the way, says something about that, believed me and helped me, and she gave me 2 products. One was like a wash that I was supposed to use every couple days, but it turned my towels orange and I didn't really feel like it helped. And the other was this lotion, you can pause, it's called clindamycin phosphate topical lotion, 1%. I don't know if that matters, but basically when you feel like you're starting to have a flare-up, you put like the tiniest drop on it and it's gone in like 2 days, and it seriously changed everything for me because I used to get huge ones that hurt so bad. So yeah, hope that helps.
All right, so in this video, there's a couple key points to pick up on. First, she talks about going to 5 different doctors before she got a diagnosis, and the last one was a female dermatologist. Now, most dermatologists should be pretty aware of this. She says 5 different dermatologists did not correctly diagnose her. I think that's really unfortunate, and I'm sorry that patients have to go through that sometimes. As far as I'm aware, most dermatologists are pretty aware of this condition, and the pharmaceutical companies are starting to recognize it more and starting to do clinical trials and develop new medications to treat it. But we see a couple of the medications that she was recommended from her physician that have been helpful. Now, just because these were helpful for her doesn't mean they'll be helpful for anybody, and you'll always find stories where these didn't do anything for some people. The first was a wash that turned her towels orange. This is probably benzoyl peroxide. Benzoyl peroxide is a topical, over-the-counter antibiotic that works often for acne. It can be helpful in HS, and it is a peroxide. It does bleach fabric, so it can turn your towels and your clothes orange if you don't rinse it off really, really well. It's just going to stain and ruin everything. She didn't feel like that was particularly helpful, so she stopped using it and did primarily use the clindamycin. This is a topical antibiotic that is available by prescription only in the United States. Clindamycin is effective at killing bacteria that live on the skin. Now, hidradenitis is not caused by bacteria. That's important to know. So this is not a hygiene issue. This is not a failure to bathe or shower adequately. Hidradenitis is an autoinflammatory condition, excess inflammation in the skin. But when you get cysts and boils under the skin, they can get colonized and infected by bacteria as a secondary phenomenon, which can make them worse. So using a topical antibiotic like benzoyl peroxide and clindamycin can be helpful to help limit the severity of them when they start to develop, and that's what she experienced there. I've had patients that have responded really well to clindamycin. It's something that I prescribe for the condition. And I've certainly had patients that did not respond well to clindamycin, which is frustrating, but we go on to the next step in treatment, which we're going to talk about. Other over-the-counter topical antibiotics that you can use are things like Hibiclens. Hibiclens is an antiseptic soap that is used before surgeries to clean the skin and eliminate bacteria. You can buy this over the counter, and often patients are told to buy it before they have surgery to clean their body off, just to eliminate staph and strep so they don't get staph infections after surgery. This, again, won't work for everybody, but when you combine some of these antibiotics, they work synergistically. For example, it's pretty common for bacteria to develop resistance to clindamycin when you use it alone. You do have to be careful with that. We almost never prescribe clindamycin as monotherapy, meaning that shouldn't be the only thing that you're on. Benzoyl peroxide is very complementary to clindamycin. So when you use them both together, you don't get bacterial resistance because you're killing the bacteria with 2 different things, and there's no documented bacterial resistance to benzoyl peroxide. So even if it in and of itself doesn't necessarily make the condition that much better, it can be helpful to be on because it makes your clindamycin work better for a longer period of time. Hibiclens is also a great antiseptic, so that's another thing you can try from an over-the-counter perspective. What if you've failed some of those topicals like clindamycin lotion or solution, benzoyl peroxide, Hibiclens, maybe even minocycline foam? That's a new one that's out now. If you've failed those, you might be put on oral antibiotics, and that's often a next step, using things like minocycline or doxycycline orally. These antibiotics have to be prescribed by a physician, and you have to have a conversation about the risks and benefits of using an oral antibiotic. But they can be helpful because they're anti-inflammatory. Again, we're not necessarily killing all the bacteria here because bacteria don't cause HS, but we can help to limit inflammation because these antibiotics have really good anti-inflammatory properties, which is why they work well for some people with HS. They can work well for acne, they can work well for rosacea. But of course, we do want to be cautious about developing antibiotic resistance in our communities, and that's why we try not to overuse antibiotics. So they can be a bridge, they can be helpful during flares, but in my opinion, it's not something that I like to use for a patient as their primary therapy over a long period of time. There's a lot of other treatments available over the counter and lots of tips you'll find online and remedies that somebody has found helpful but somebody else may not have. I want to look at a video here that talks about using African black soap as a way to help treat HS. Let's look at that one.
So I got this question a lot. What do I do for my flare-up? And I will get more videos on that, promise. At this point, I had drainage and pain, so clean up with me. My favorite is black soap. I know some people, they got their things, but look at those benefits. After that, I wash it away, pat it dry, all the way, and oh, there's a plug. Sorry, not sorry. But look at all those benefits, though. In this case, I use hand warmers in my little satchel, and sometimes I use a rice sock, but there I go, and I'm off to bed. Good night, I'm tired.
In my last video about acne, where I reacted to TikTok videos with Cassandra Bengtson, we talked a little bit about African black soap. It is an alkaline soap. It has sometimes made with shea butter and other moisturizing ingredients, but as a soap, it often has sulfur, and it can help to kill bacteria, which is why it might be helpful for some people with HS. But again, this is not a real strong thing. It's probably not going to be helpful for most people, but it's a low-risk intervention if you want to give it a try. She's talking about having a lot of pain, and we've seen a couple other videos that talked about the intense pain that can come with these cysts and these boils, and it is really painful. And so that's one of the reasons we need to be aggressive about treating it, and it's why it's important for doctors to diagnose this quickly when a patient comes in with a history of recurrent boils and cysts under the arms, under the breast, in the groin, or on the buttocks. If you've used some of these topical therapies and they haven't worked, it's definitely time to make sure you're visiting with a board-certified dermatologist to explore other options. Now, one of the things that goes on inside the head of somebody who has HS is their daily routine is different because they have to be prepared at any time that a cyst or a boil could rupture, and what are they going to do to deal with that? This next video shows a little bit about how the preparedness factor has to work for individuals with HS.
What's up, you guys? So I just wanted to come on here and let you guys see what's in my to-go bag when dealing with hidradenitis. When we go to the restroom, you guys, we cannot neglect this thing like it's nothing. You know, we want to go to the restroom and pretend we're a normal person, go pee and wipe ourselves and go. And we can't work like that. So I'm going to show you guys what I have in my bag. I keep this on me so I can make sure I maintain a healthy, clean outer layer of skin. And so I have this called Bactine
spray.
It's pain relieving cleansing spray. I spray this on the wound and then I wipe it off with a cotton ball. I've already used my cotton ball, but I also keep gauze on me, and I cut it into like little pieces, and then I cleanse it, wipe it off with a cotton ball, and then I use the Neosporin cream, the pain relieving cream, and I put it on there and I put it on the wound, and then boom, good to go. Wash my hands and all done.
We can see here that she has to take a bag with her every day that has things in it that she uses just to manage her HS after using the restroom in case anything happens to pop. And she uses Bactine spray. It's a mild antiseptic spray. It has a little bit of pain relieving qualities, can be irritating to some, but if it works for her or it works for you, that's totally fine to use. That's a pretty big bottle to have to carry around every day, but it's something that should illustrate to you how intense this disease can be. She also has Neosporin in there, especially the Neosporin pain relieving cream. Now, dermatologists are often not crazy about Neosporin because neomycin is one of the main antibiotics inside there, and it has a high rate of causing contact dermatitis or allergic reactions. But if it, again, works well for you, that's totally fine to use. Just be aware that if you start developing a lot of irritation, you may have developed an allergy to Neosporin itself. It is the pain-relieving kind of Neosporin, which means it also has an added ingredient called pramoxine, which can be anti-itch and a little bit of topical analgesic to help reduce pain. So that's okay, not a lot of contact allergy to that ingredient in particular, but this is a routine that works well for her, but it's something that every day she has to prepare for, cutting up those gauze pads and making sure that she has everything that she needs in there to get through the day. The next video that we're going to watch is a little bit more graphic, so I want you to be aware of that. This is one of the reasons that individuals with HS need to be prepared every day, because if a cyst or a boil ruptures, they have to be able to manage it. They often go through more pairs of underwear, undergarments, clothing, because it can get ruined by blood and pus that come from these cysts and boils and get on their clothing.
Alright, so this is after 5 days of it becoming inflamed and then doing stuff at home to try to pop it. So it finally burst last night.
Very frustrating.
As far as I can lift my arm without it hurting. So I'm going to go in and close it. Hot water and also wash.
I love that. She made it her mission to make sure nobody else feels alone. Because again, it's a very isolating disease, but look, just gentle pressure and expressing the purulent material. But this can be a daily battle for some. This can be the only thing they can do to get pain relief. You are not alone. You are warriors with a tribe of amazing people behind you. I love that message.
So now I'm just going to go in and tape it up. It's not all completely popped. There's still 2 more tunnels that haven't popped. So there's nothing I can do about that.
She just has to wait for them to pop.
I have a doctor's appointment today. I'm going to go in, see what they have to say, see what we're going to do, and I'll know more on Tuesday whether or not I'll be having surgery again or not. So, love you guys.
Good luck. So that drained a lot of material, but she said there's 2 more under there that still haven't popped. She's going to go see the doctor, and this is the daily reality that individuals with HS can live with. And it makes my heart go out to them because the treatment options, like we've talked about, are often unsuccessful. There's one other treatment that is approved by the FDA, and this is called Humira or adalimumab, and this is an injection. It's been around for probably 20 years or better. It's often used for conditions like rheumatoid arthritis, psoriasis, psoriatic arthritis, Crohn's disease, and ulcerative colitis. These all have in common that they're autoinflammatory or autoimmune conditions, and they're due to excess inflammation in the body. And Humira can help to bring that down by inhibiting a molecule in the body called tumor necrosis factor alpha, or TNF alpha. Now, this medicine does come with some risks. You have to get blood work before you go on it, but I prescribe it frequently for patients with psoriasis and for hidradenitis, and it is something that can be done very safely when it's monitored under the care of a physician who's familiar with the drug and familiar with the condition that they're treating. But you do have to have a visit with the doctor to make sure that it's appropriate for you. It's currently the only thing that's actually approved by the FDA to treat hidradenitis. That means they did clinical trials, and those trials did show a benefit for individuals with HS. Again, it's still not something that's guaranteed to work for everybody, but everything else we've talked about is an off-label use. There's no clinical trial that shows that doxycycline or minocycline are going to be FDA approved for the treatment of hidradenitis, but we know that they work through clinical experience and sharing case reports in the literature. However, the only ones that have done the clinical trials to show efficacy are AbbVie, which is the pharmaceutical company that owns the drug adalimumab or Humira. So that is something to take into consideration. If you do have this condition and that hasn't been something you've discussed with your dermatologist, it is worth having a conversation about that. It is a crazy expensive medication, however, so that is something to keep in mind. If you don't have health insurance, you may be able to get on a prescription assistance program directly from the pharmaceutical company, from AbbVie, because it is important to them to help you get on medication. The next video that we're going to watch will quickly illustrate another little hack that somebody goes through to help manage that day-to-day life of struggling with HS.
Hey guys, just 1 second. I got a way you can upcycle those pads for your HS needs. Unfortunately, it only works if it has wings. These are sanitized. I start by cutting off these ends, and I cannot do this with one hand, so I'm going to do some magic here. There we go. So now we just want to use this area. Cut these ends down to sides so they're flush with the pad.
It's clean,
like so.
It's absorbent.
Like that.
It actually can
this keeps
have
the sticky parts from sticking to you. Now you can remove the front paper, and that's your stick. And she goes with that underarm thing again. Now lift your arm, place the first part above the scar, bring the pad down, and place the other sticky part under the scar. There'll be a little fold in it, a little hole, that's fine, because you're gonna press and put it down. And now you're ready to go.
So that's kind of a little ingenuity to help manage HS on a day-to-day basis. If they have cysts or draining sinuses, that can be helpful. So something that I didn't know, I've never seen that happen before, but just looking at that ingenuity, you've got to solve problems. And again, it shows every day. Individuals with HS have to be thinking about how they're going to manage it, and there's a lot of solutions that they might need that the market really hasn't solved yet, so they're coming up with things on their own. So far, we've learned a lot about hidradenitis. We've seen some of the people that it affects on a day-to-day basis, and it doesn't matter what your size is, what your age is. It can happen to anybody, but one thing we haven't looked at yet is how it can also affect men. Now, this one's going to be a little bit different, and I'm going to do some clarifying for you afterwards, but I want to share the story of Paul from TikTok, and he talks about his experience dealing with hidradenitis.
Hey, don't swipe. It was hard enough for me to decide to make this video, so just bear with me for another 50 seconds, and I will explain why I'm here. My name is Portela, and I deal with a condition called hidradenitis suppurativa. HS for short, because I know hidradenitis suppurativa sounds like I'm casting a spell. I don't know how to do those. However, I would like for you to follow my
casting
page,
a spell.
and I will go through the processes and the things that I have to do to manage this condition. I will show you pictures of how I look when I'm not flared up. I can talk about how I manage being a truck driver, being a family man, being a friend, just being a human being. This last week has been very depressive for me because of the fatigue, because of the pain and the lack of sleep. However, this video, I will just introduce myself. As you can see, the flares here, they're subdermal.
Up on the head.
This one here, that's my best friend. These, and all around. However, follow my page, and I will tell you more.
So Paul Taylor there talks about his experience with hidradenitis. I looked at a few other videos on his page, and everything affects him on the head. So this is not true hidradenitis, but it's a very, very similar pathology. It's called dissecting cellulitis of the scalp, and if you were to take a biopsy of this and look at it under the microscope, the disease process is going to be essentially identical to hidradenitis. It's just called a different name because it happens on a different location on the body. So dissecting cellulitis of the scalp, along with hidradenitis and acne conglobata, are something that we call in dermatology the follicular occlusion triad. Some people will even add in a fourth condition there, a pilonidal cyst or sinus, which happens over the tailbone, which can be deep and drain pus and be really hard to get away. And those collectively are called the follicular occlusion tetrad. So 4 different conditions with a very similar pathology. They're due to excess inflammation in the body. They just affect different body regions. So acne conglobata can be severe cystic acne all over the face, the chest. Hidradenitis, of course, we've talked about the areas that can affect. Dissecting cellulitis of the scalp can have cysts and boils all over the head, down the face, can be really challenging. And then the pilonidal sinus happening over the tailbone. That usually needs surgery with a general surgeon to get that to be resolved. All of these conditions lead to social stigma, isolation, depression, and just that day-to-day battle that's really hard to talk about, but they're much more common than most of us realize. So I do think individuals like Paul and the others that we've looked at for sharing their story and having the courage to get out there and help others to not feel alone. The last video that I want to review is also from Paul, and he is talking about a few of the things that have helped him to have fewer flares. And again, these are things that you can do over the counter, but they're not going to work for everybody. And I'll talk about that a little bit more after we watch the video.
Yes, surgery, getting lots and lots and lots of lancings, etc., can cause so much scar tissue to build up in the areas, especially if you consistently have to go get them drained. That can cause an issue. It can cause the tunneling to be even worse and travel even further.
It's true.
I have definitely had those issues. Surgery has worked for me on certain areas, like this area. It does swell, but I guess the good part about it is when this swells, it gets really, really big. But the 3 little holes here from the needle when I had gotten my stitches, and if I take a clean needle, a sterilized needle, I can poke it in a drain and it come back to normal. But yes, surgery does not always help. It's a case-by-case thing, and everyone, as you know, everyone is different. Diet recommendations for me. The best thing that works for me is one, you have to cut out the majority of carbs. You have to cut out the majority of carbs. That includes like all of my favorite foods that are even vegan, because I'm a majority vegan-based diet. The breads, the pastas, etc. Cutting that out makes a major difference. As well as the number one thing for me is having the majority of my meals being live, leafy green vegetables, aka salad, or for the lighter meals like breakfast,
lots of fiber in there.
Lots and lots of fruit and fiber. Those things go through and help clean out the gut, because the problem really lies within our gut. For whatever reason, our gut is able to take things that we can usually utilize for our good, and our body fights against it. So you want to be able to cleanse the gut as often as possible. So that's my diet recommendation.
Exactly there.
Mostly raw, leafy green vegetable foods with your heavier meals, and lots of a variety of fruit with the lighter meals. And take your zinc, take your vitamin C, drink lots of water, exercise, and cut your carbs and your sugars. But definitely your carbs and your sugars. Anything with yeast, dairy, all of those things, for me, cutting those things made a major difference. I hope this helps you, my man. Yeah, just let me know. Peace.
So here we learn a little bit that surgery for him has helped in the past, but not all surgeries were successful. Sometimes getting rid of one just causes it to tunnel in a different direction along the scalp. Same thing can happen under the arms in hidradenitis unless you do a really radical resection and just get rid of all of it. Again, we've talked about laser hair removal might be helpful, but then we get into dietary recommendations, and this is where there's not a ton of data on that, and everybody's going to have a little bit different experience. You certainly may find individuals who have improvement by cutting out dairy or high glycemic index foods. These are the things that may be helpful in acne, and because the pathology is a little bit similar in HS, we can see some results in some individuals with that approach as well, but it's not to be taken as the rule. It's more the exception. So if making a big dietary change helps you, more power to you. Definitely do it. If you know that you eat a poor diet, then I would encourage you to visit with a dietitian and make changes just to be healthier overall. There probably is a lot more of a role of gut bacteria and the gut microbiome interacting with the skin microbiome, and how that all interplays to develop with hidradenitis. We just don't know a lot of information about that yet, but studies are ongoing. What we do know is that the more that you can do to be healthy inside usually reflects on the outside, but there's no standard recommendation for a dietary change to help improve HS. There is a little bit of data to say that zinc supplementation can be helpful, but definitely don't overdose on zinc. It can lead to other problems, upset stomach, and can throw off other vital minerals in your body. Essentially, what this all means is, again, If you suffer from HS, it's important to visit with a doctor, and he even showed that in that last video. If you noticed up in that text on, kind of above his right shoulder, that he encouraged everybody to visit with a doctor to find out what's right for you. This is just him sharing his story of what was helpful for him, but not necessarily him making a recommendation that he promises will be helpful for you. First off, as we start to wrap up, I want to make sure that if you're watching, you can ask questions down in the comments and I'll answer them, and maybe even make some video replies to provide more content for you. Second of all, to the individuals whose videos were shared on TikTok, I want to thank them for sharing their stories, for being brave enough to put themselves out there to help others to not feel alone. HS is an isolating and stigmatizing condition, and the more people that share their story, it's just going to help others. And dermatologists are the most well-equipped to diagnose and treat that, and in some cases we have to involve our colleagues from surgery, plastic surgery, general surgery to help take care of really big areas that might need a surgical resection. We talked a little bit about the various treatments that are available, from topical treatments to oral antibiotics to even an injectable immune modulating medication like Humira. For all of those, it's best to visit with a dermatologist to determine if one of them is appropriate for you, or a combination of medications, because it's not very common that just one of them will solve the problem for you. If you have HS, you can look on Facebook or online elsewhere, because there are definitely HS support groups that you can join, meet up with people locally, and have that support and discuss the condition, find out what has worked well for other people, and just to not feel alone. I would encourage you to do that. So again, I want to thank you for following along. This video I hope was helpful, especially for people who have HS or may know somebody who has HS, and maybe for that person who doesn't know that they have HS yet, but they've just had a few cysts or boils that have happened from time to time, and they're not getting the diagnosis or the help that they want or that they need. So hopefully that will be helpful. You can find a board certified dermatologist who can help to diagnose and treat the condition appropriately. Again, make sure that you're subscribed to the channel, ask questions here, follow me on Instagram. You can even text me. You'll find that number down in the description of the video below. Thank you for watching, and I'll see you next time.